So when I was about 5 or so, I wasn't sure if I was meant to be a boy. I was rather introverted. I was really into books, and I would sort of isolate myself, make piles of books, and just sit in my little circle of books and just kind of read one of them or something. I wasn't really into the stereotypical boyish activities and sort of roughhousing, and I felt a bit strange about hanging out with the other boys my age.
I am a detransitioned woman. I was on testosterone for 6 years. I transitioned at age 24. I got a double mastectomy and a total hysterectomy.
My mother had various boyfriends who were violent, and there was a lot of craziness going in our household, and just people coming and going. And I began to cross-dress a little bit. I began to think somehow that I was meant to be a girl and that I would someday grow up to be a lady.
As a kid, I was very gender non-conforming. I thought that I was supposed to be a boy and that my penis just hadn't grown yet. People thought that I was a young boy and would call me young man or sir or whatever on the street, and that just felt so good. As I got older, I experienced what I believe is true gender dysphoria when I began to go through puberty. I was no longer that little boy or, the girl who looked like a little boy. I was turning into a woman.
Somehow I encountered the Gender Trender blog. This was August 27th, 2013. It was there that I learned that children were being transed. And I just couldn't believe it. I felt this complete revulsion. I wanted nothing to do with any of that insanity, especially the transing of children. It just blew my mind.
I sort of woke up one day and I realized that I had transitioned out of trauma, and I had basically been running away from being a woman. I have been documenting my process of detransition on YouTube because I'm extremely nervous about children transitioning. I feel that children cannot really consent to these procedures.
I've been taking very serious interest in developments in the United States with regard to gender ideology and the movement that's driving that. And of course, I've been taking a very similar interest in the same movement in the United Kingdom.
In just 13 years, we have had an explosion of the incidence of this concept that you're born into the wrong body. And these transgender clinics have popped up to offer services throughout the country.
The state level fights on gender identity policies are really just getting started. In regards to children, the first laws pushing back against the loophole through which total affirmation of a child's gender identity claims were put forward, and the first was in South Dakota, the Vulnerable Child Protection Act.
I am transgender, I have completely medically transitioned, and I do not have a dog in this fight. I'm trying to save your kids.
The idea of the Vulnerable Child Protection Act was to prevent people going down that path until they were at least 18 and could be more mature to make these decisions.
And the males who had grown up as male and decided as adults to become female, their voice is deep because the larynx has been subjected to testosterone. Their torsos are big, their shoulders are big, their feet are big, their hands are broad, things that don't look very much like a woman. And so they said, if we stopped it before we ever got there, that would be ideal. And that's what drives the puberty blocking, is the wishes of the adults who have not been happy with what their bodies did on their own, and they don't want that to happen.
This means that any male who just declares themselves to be a female can go into a female prison or can compete in female sports or any other public arena where sex used to matter. They can just self-identify into them.
There was a conference some years back in Yogyakarta, and they came up with the Yogyakarta Principles, where a group of LGBT activists also got together with some gender identity activists. They created a blueprint for, what would be your ideal policy set.
My 16-year-old daughter has been trans-identified for the last 3 years. The very first day that I discovered that my female daughter thought that she was a male, my very first gut instinct reaction is to call the pediatrician.
I am a pediatrician at the Upper School of Medicine, Brown University in Providence, Rhode Island. I use she, her, they, them pronouns, and gender fabulous kids are who I work with. We should be listening to kids and listening to parents, because you can't treat a child without working with the family in whatever shape and size and configuration the family is.
My son lives about 5 hours away. He's 11 years old now. At about the age of 4, I started noticing that he was having interests in what would traditionally be called girl things, like dolls and princesses. At around that time also, his mother put him through some testing, and he was diagnosed with autism.
For a 6-year-old, there's no intervention that you're going to be making other than a social one. So using their names and pronouns, allowing them to dress as they feel comfortable. For a 16-year-old, the story is quite different.
My son, he has expressed to me that he doesn't want to develop into a boy. He doesn't want to go through puberty. He doesn't want to become a man. He's uncomfortable being a boy. He has a fantasy of taking a potion and being like Peter Pan. They were laying on the pressure more to my son's mother that if we don't do this soon, your son is going to miss his opportunity to transform. The window's closing, and if your son reaches biological puberty, you're going to miss the opportunity for him to be the person he really wants to be or can be.
When we're speaking of rapid onset gender dysphoria, overwhelming probability that there was something messy going on in the family, a bad divorce or something like that. There's those kind of underlying issues that need to be dealt with. And the understanding was that since they're tied together, perhaps proper psychologic investigation and support toward helping those mental health issues, overcoming the traumas, the adverse childhood events, helping the family dynamics, that when you help correct those, you also will be helping to correct the gender dysphoria. But that's the idea of watchful waiting.
The way I would treat a patient with gender dysphoria is very unique to that patient. I think the primary goal that I have when I'm first evaluating a child who's coming in with gender dysphoria is just getting a sense of how they're feeling, validating that feeling, and then kind of exploring where that might be coming from, whether or not there's any underlying issue or trauma or circumstance that may contribute, and then to have a really sincere conversation with them and the family about how we might want to move forward from there.
Gender is sort of this concept of masculinity and femininity and how we see ourselves and how culture sees us in those type of roles. So when you look at biology and diversity as normal, which is what is normal, but as expected, let's say, and then you look at diversity as diversity is good, then you have to go back and say gender diversity or a transgender identity isn't pathologic. It's a part of human development. And it's a section of human development where some person's biological, external, visible parts at birth didn't match the biology and the internal gender that was growing and evolving inside them. Little boys should be baking and they should be able to play with dolls, and little girls, they can play with trucks.
I have a daughter who started doing this at age 13. She first said she was agender, which is like non-binary. She is just turned 19, and she still is trans-identified male, and she started testosterone in June, and we saw a psychiatrist. She said that this has been around for thousands of years, it's just coming out of the closet, and that if I don't go along with this, that she could likely commit suicide. She said that right in front of my daughter. I always thought that doctors had a Hippocratic oath, first do no harm.
I have a 23-year-old daughter who started this when she was about 15. She doesn't live with us, hasn't since she was 18.
When my son was 21 years old, he told me on a car ride that he had always wanted to be a woman. He subsequently pursued that identity and is still living as a woman. My older daughter went through some teenage angst. She's about 15 or 16. She cut her hair, she wore some different clothing. I asked her if she was wondering about her gender. She wanted to be a boy. She denied it. And it wasn't until she was 23 years old that she legally changed her name and started taking testosterone.
And we use a roadmap because a treatment plan or a protocol or a policy, again, is not going to help our kids. So we have a roadmap that gives directions to children, youth, and families. This is how we can provide multiple options of care for you. And you, in your gender journey, are driving the bus, right? The kid's driving the bus. The parents in the front seat going, oh, what's going to happen? You know, it's scary when your kid's driving the bus. We're in the back seat and we have the roadmap. And we can help families and children select from a number of good, hopefully, options and avoiding the less good or the harmful options.
I have a daughter who is currently 11 but was 10 when this started. The most challenging thing for me has been the realization that most of my community and my friends and even some of my family is not supporting me and thinks that I am making the wrong choice for my child, who I've known her entire life, you know? I feel so betrayed.
I have joint legal custody of my son, which says in very plain language that I have 50-50 rights and decision-making in such things as medical, religion, education, all the important institutions of any child's life, you could probably say. I would argue that if you take away a parent's ability to ultimately have a say in your child's most important parts of their lives and their biggest choices, you know, take away the authority you have over your children in general, then you are undermining everything that makes families work.
I knew she needed help. Everywhere I went to try to find help, all they wanted to do was affirm her and put her on hormones. I even took her to the Children's Hospital, and we saw a psychiatrist. She told me that it was too late for puberty blockers, because my daughter was 15 then. But she said we could send her in endocrinology for the testosterone.
I miss my daughter so much. I had a tremendously wonderful bond with her. I love her. I adored her. A part of my heart has been ripped out of me.
My entry into investigating the scientific evidence related to the current treatment paradigm for individuals with gender dysphoria occurred shortly after I assumed the position of chief of our division of endocrinology and at my institution. And it was at a time where one of my faculty members approached me with a desire to begin a gender clinic. The clinic was specifically for children. The Endocrine Society guidelines had already been published for several years. The World Professional Association for Transgender Health, WPATH, had several iterations of their recommendations.
It's actually based on a very old trend which happened back in the late 1970s at Johns Hopkins. John Money was a faculty member at Johns Hopkins, had been there since the early 1950s. He had a particular interest in children with sexual differentiation disorders. was his concept that gender was sort of the internal sexual identity that was established at some point in time. So if you look at medical literature prior to 1950, 1960, gender wasn't a word in medicine, it was a linguistic term. His idea was that there could be people who had a sense of sexual identity that was different than their biologic sex. And he applied this originally to adult patients, and he had a cadre of adult patients which he called transsexuals who thought they were born in the wrong body.
I do see some families that have children in them, or even adults for that matter, that have gender identity issues. It's becoming more prominent. I mean, it's catching on because it's the hot topic. It's all over the media, social media in particular. It's in the entertainment industry, and now, of course, it's made its way into education.
My daughter's rush to want testosterone was really fueled by her desire to be seen as male. She wanted to have a hairier body. She wanted to have bigger muscles. She wanted to have a deeper voice and perhaps have facial hair. And there's very little research as to the long-term effects of testosterone in the wrong-sexed body. So this was not something that I was willing to rush for her to do. And what little research that I was able to get access to, you know, some of these consequences were irreversible, life-changing, and damaging to her body.
So what's being pushed very hard now is the idea that gender affirmation therapy is the proven therapy. Otherwise, you're going to see this monumental rate of suicide. Or as is told to parents too often, do you want a live son or a dead daughter? There is no long-term evidence showing gender affirmation therapy reduces suicides. It's not there.
They scare parents into, your child's going to commit suicide unless you let us put them on these puberty blockers.
The pediatrician, she said that if I didn't affirm my daughter's identity and I didn't get her the help that she needed and she killed herself, I was going to feel awfully guilty. I'm right in front of my daughter.
She was being socially transitioned by the school without my knowledge. She got in to see the special therapist, and they really pushed that this was such a great therapist. And I know now that this therapist had been calling my child a boy and using their, made-up name.
In terms of studies that we have out there for gender dysphoria, I think that some of them are limited in smaller numbers. I think the overall consensus is, and there have been some good studies done, that there is a very, very high risk for increased rates of suicide or attempted suicide in children who are transgender specifically.
We're starting to see finally some discussion about the limits of a child's ability to give that consent. And when you're being told by a medical professional that this is something that's good for your child, and to not do this is going to be harmful, it's very, very difficult for a parent, to challenge that, especially if they don't have the medical background. Parents are very protective of their children, and they want the best for them. And many times that they will know that, or at least feel that this is not the right approach, but they really don't have an ability to challenge that. The reality is we don't have any long-term studies in children, and there's a very good reason to be concerned about the outcome. Specifically, some of the largest studies that have been done with the longest follow-up have shown that suicide rates remain markedly elevated after you undergo these affirmation interventions.
There's one study, and that's the study by Deshny. They followed up every person who had gone through trans surgeries from earliest times through, I think it was 2007. There were some 324 people of both sexes who had been through the process, and they were included in the study. There was a 19 times higher hazard of suicide, of completed suicide. This is in the context of Sweden, which was by far the most welcoming, accepting society of transsexualism, even through the 70s.
If you look at the package insert, this is what is required by all drug manufacturers to put all the information about risks and benefits of their particular product. In the package insert for the puberty blockers, they mention as a side effect changes in mood and depression and suicide risk. The concern about depression and suicide is real. That's not to be dismissed.
We ought to think very hard about what and who is driving this extreme trans activist agenda. One thing that is particularly striking is that as soon as anybody expresses any kind of mild criticism or any type of considered criticism or raises any doubts, they are denigrated as transphobes and as haters.
I was kicked off Twitter in 2018. I had been speaking out about gender identity, ideology, and legislation on Twitter. I had been writing about the issue on my website. I didn't say anything antagonistic. I definitely did not think that I was breaking any Twitter rules. So when I was kicked off, I was really quite shocked. What I had said was, men aren't women. I had said that as part of a, thread that I was engaged in on Twitter. It wasn't directed at any person. So I wasn't saying to somebody, you're not a woman, you're a man.
I'm a former evolutionary biologist. I left academia partly related to a lot of the more controversial essays I've been writing, and there's a lot of pushback to people in my field. It's happened quickly, sort of on all our radars, but it's been a slow burn. It's had a long fuse in the universities. The humanities departments, the women's studies departments, queer theory is one of the main drivers, which is this notion that they need to sort of try to destroy and take down any notion of a binary. They try to blur the borders between things because they think that a lot of these notions of male or female, man and woman, these are constructed by people in places of power. And they were saying biological sex itself is, these categories aren't real, male and female. And it's just all, just all on a spectrum. They all just kind of blend together. This was just an absurd claim to me. And that's where I started staking out my territory, because I'm a biologist. And so I know what the biology is of biological sex. People say, well, sex can't be a binary, or there's more than two sexes because some individuals are intersex and they have either ambiguous genitalia or they have different chromosomal configurations. This conflates the notion of what biological sex is. It's related strictly to whether or not you have testes versus ovaries. Then many of these intersex conditions are examples of variation within a sex and not variation of sex itself. It just means maybe certain individuals, incredibly rare individuals, might not fall neatly into these categories, male and female.
We don't need gender for anything. I mean, when we're talking about material reality, all we're talking about is whether or not you have a male body or a female body. And then you can have whatever personality you want. You can wear whatever clothes you want.
There's great fear on the side of the trans activists that when truth is out, when they are challenged with science to their face, they have no leg to stand on. So they avoid dialogue at all costs.
I've been told that I am not a nice, inclusive person for saying that the law needs to be able to recognize sex. And not just me, but all the women who don't believe that human beings can change sex.
We went to the Supreme Court. We had filed a brief in what was then the Harris case. It's now known as the Bostock decision. And our concern was, so there was a man named Amy Stevens who wanted his employer at a funeral home to allow him to present it as a woman at work. And what this meant was that he wanted to follow the women's dress code and use the women's facilities. So we went to have a rally with the folks who represented the funeral home and with a wide range of sportswomen, parents of children who had transitioned. It was hours and hours of just being screamed at through megaphones at really close proximity.
There are doctors in the U.S. who will go to work today and oversee the chemical castration of little boys, who will put 14-year-old girls into menopause and give troubled young girls cosmetic mastectomies.
One of the things that I was talking about when I got up to speak, and it was I'm so sorry.
In closing, to echo my sisters in the UK, a man can never be a woman. A lesbian can never be male. My name is Natasha Chart from New York State. I will not be forced to lie. I will not submit.
There are some activists who are powerful, who have money, who have access to politicians and the media and big pharma and the Human Rights Campaign. They've created an agenda, and they've done a really good job actually with their marketing campaign.
So let's say big pharma, biotech. If you've got a company that's producing some little widget that has a stake in the game of making a biological male look more female or vice versa, there's money for you in this.
I started to push back against these same ideas, and instead of just being attacked on factual grounds, I was really starting to be attacked on moral grounds. They weren't really saying I was wrong. They were saying that I was not only wrong, but a really bad person, that I need to be quiet. This is not my space. And that just didn't sit well with me, because the reason I wanted to be in academia in the first place was because I thought that was sort of the area that you go when you want to pursue truth.
I was supposed to talk at the University of West Australia. I was invited to come and speak in Sydney and in Melbourne and Brisbane and Perth and Canberra. My talk was shut down on the campus at the University of West Australia in Perth by demonstrators. I was to give grand rounds at the Susquehanna Medical Center, and I was canceled on Tuesday before my presentation on that Friday.
Most sort of open-minded liberal people think, wow, they're just being themselves, let them be themselves. Think about it a little bit more deeply. You know, this child, would you give this child a car? Would you let them go buy drugs? This is a child, they don't have mature judgment.
So gender dysphoria doesn't necessarily mean somebody is trans. I was, the textbook case, young kid who acted like a boy, identified as a boy, told people that she was a boy, and, developed gender dysphoria during puberty. And yet I still ended up detransitioning because it wasn't right for me, because I'm not supposed to be a man. I came out as bisexual, and then later I came out as a lesbian.
I was still using the name Tara. I was still, using women's restrooms. And I thought, why am I pretending any of this stuff? That evening, after crying for a while, I just realized I'm not going to play along with that anymore. I don't care how people perceive me. My name is Hachi, I'm a man, and that's all there is to it. It's simple as that.
And this is an area I think is underappreciated as far as the actual number of individuals that have this experience of going forward with the affirmative approach, including hormones and surgery, to later recognize that that it didn't solve their problems.
When I was young, I was molested by a family friend. That was extremely traumatic for me. And then I had an affair with a teacher when I was 13. That was particularly traumatic for me as well. And then I had an abusive sexual relationship with a therapist, and that was extremely traumatic to me as well. And that's around the time when I started identifying as trans. because he said that I seemed like I was trans. He was trans too. And I think that, the trauma also influenced my ability to see myself growing into a healthy, mature female adult woman. The people who molested me, they wanted a female child. It became so much easier to think that that didn't happen to me, that happened to this other person, to this little girl. And I was not that little girl anymore. And I looked in the mirror and, I had been trying to be a man for so long that I was used to myself looking and sounding like a man, but it still wasn't right. And this disconnect hit me, and I was like, I can't recognize myself in the mirror. Like, I was such a pretty girl. I was such a good girl, and then I just ruined it, basically. And I turned myself into this hairy man, and now I'm, stuck looking and sounding like this forever.
I was the oldest of 5, later 6, and I always felt that I needed to be responsible. We often didn't have food in the house, and I would go shoplifting. I would literally just walk in the store and fill up the box with just basic staples. Because things were so crazy, of course the police got involved, and we were taken to foster homes several times. So things were just really, really scary and crazy. With all those violent men, it made me feel like I don't want to be a man. One day I noticed that my employer was offering full-on transgender treatments, hormones, surgery, everything as part of their health plan. And because I'd been having this problem with the U.S. Passport Agency in getting a female passport, I'd had several of these one-year passports where they say, okay, 1 more year, but then you have to have the operation. I went down to Stanford to meet with the surgeon who was appointed to perform this operation on me. And he asked a lot of questions about, well, maybe you should have the full surgery, the neo-vagina. I recognized that he was trying to upsell me. So I thought, well, if I have the orchiectomy, having my testicles removed, that will satisfy the passport agency, and I can have it all, everything will be accomplished. And I can tell you, based on my experience, 10, 12, 13 years into my experience, I thought there was not the slightest chance that I would ever resume my normal life and say I'm a man and stop masquerading. I just thought that was just absolutely unreal, out of the question. I'll be picnicking on one of Saturn's moons before that happens. And I remembered having read Janice Raymond and Mary Daly, and I realized that I can't even do this anymore. I think I'm harmless, but I'm not harmless. Everything I do is undermining women, and it's all actually just fakery. And I realized it's just a mask, and it's just a masquerade. I resolved right that day that I was just going to take my name back and just be myself and stop trying to make people think I was a woman. I mean, that's what detransition is. Do you try to make people think you're the opposite sex or not? That's all.
Right now, the data suggests and continues to suggest that kids that go on blockers will stay on them and probably go on gender-affirming hormones or explore some aspect of a gender-diverse identity. But that's the benefit of blockers, is you don't have to decide. And they're safe. And you have time and room to figure things out, and your parents have time and room to figure things out. And nothing's permanent. It's the pause button on puberty.
Commonly, almost all individuals that are put on puberty blockers eventually go on to take cross-sex hormones.
One point I think that's really important, to recognize is that you can't say that it's reversible either, puberty blockers. You've interrupted a normal developmental process, and you can't buy back time.
Miles was just weeks away from getting a referral that would be able to administer puberty blockers and cross-sex hormones. He was entering Tanner stage 2, which, as I understand it, is kind of the very beginning stages of puberty. They actually put this in the notes that Miles was starting to grow hair around his penis and his testicles.
If you're a pharmaceutical firm that is producing some manner of sex hormone or gonadotropin-releasing agonist, what we're going to call puberty blockers, you've just increased your market share tremendously. And once a kid is medicalized, they are medicalized for the rest of their lives. That's a big market. It's a big profit.
A puberty blocker will give you time to, let the child sit in this gender role, really think about it, let the family settle into it, and sort of time to decide, what the next steps would be.
And then we need to tell parents, again, we want to do this in a safe and healthy way because we know this is totally reversible and this will give you and your kid time to figure things out. We don't want to cause great debt for you because we need, we want to run it through the insurance company. I mean, we're looking at all the different factors with the kid, the parents, and the family to say, of these options for care, this is what we recommend. Listen to your kid, accept your kid as they are, love them, even if they're not who you expected them to be. Don't wait till they're 18 to let them decide and be who they need to be. Don't deny them access to care that we know is safe and healthy.
Puberty blockers, by and large, are completely, reversible. That said, there is some evidence that there may be some potential for decreased fertility using puberty blockers. And there are options for fertility preservation that they may want to pursue.
Doctors say it's completely reversible. It's not completely reversible.
If you've blocked pubertal development, you've prevented the gonad, the testes or the ovaries, from normally developing, and then you expose them to hormones that they would not normally be exposed to. The expected outcome of that is that you're going to render that individual infertile and likely irreversibly.
The reason I'm being difficult in this is not because I don't love her. It's because I love her so much that I am willing to take on this whole ideology just to protect her from potentially making an irreversible decision in her future. And even if that means that she wants to hate me and she doesn't want to talk to me, I love her enough that I'm willing to keep fighting for her.
In many of these clinics, they recognize the potential for infertility, for sterilizing these children, and they will have a discussion about ways to preserve fertility. Yet the number of children that actually accept that offer for fertility preservation is exceedingly small. And it reflects potentially their inability to grasp what they are giving up at that stage of their life.
Puberty is a critical part of changing a non-fertile person into a fertile adult. And there's so many things in the human body and the brain that depend on that transition. Our bodies need that. They are expecting it to happen. The cells of the body are already designated as male or female throughout the body, and they respond to the hormones that they're expecting to see to mature organs, taking the prepubertal gonads and making them produce hormones and fertility-inducing cells, that the sperm and the egg, so that the human species can reproduce.
And obviously, if you engage in sex reassignment surgery, again, what they prefer we call gender affirmation surgery, you're removing the testicles, you're removing the ovaries, so infertility is guaranteed. Other complications with cross-sex hormones, the risks of blood clots, strokes, heart attacks, various cancers. The list goes on from there.
Because of my mental illness, I felt that it wouldn't be fair to pass on my genes to a child. I do wonder sometimes what it would have been like to have a child that's biologically mine.
A child and a parent, at least one of the parents, is going to have to demonstrate that they understand what it is we're doing, what the risks are, what the benefits are, and give that informed consent for that intervention.
I didn't know about the true dangers or potential risks of testosterone use in women. And so, there are problems that I have now that I wasn't warned about these potential risks before going into the surgical options and hormonal treatments. And so now I'm just beginning to deal with the effects of years of testosterone use and surgeries.
Now, after somebody has had pubertal blockade, and then they've gone on to have cross-sex hormone therapy, they are then, traditionally, when they reach the age of 18, again, that's being challenged and offered at younger and younger ages, is to have surgical interventions to further facilitate the transformation of the physical appearance of the body to conform to the desired sexual identity. The majority of patients that have surgical interventions, it's going to fall into that category as far as top surgery. A smaller percentage of them will desire to have what's referred to as bottom surgery, to have surgical intervention to change the appearance of the external genitalia. Again, with irreversible consequences in the ability of those sexual organs to function, with many concerns about surgical complications related to that, and really locking that person in, to disruption of the normal function of that part of their anatomy.
A biologically female body will now be given large amounts of male testosterone. The way that's approached is to say it's the normal level of testosterone for a male. That may be true, but for a biological female body, that's enormously more testosterone than it would ever see, short of something like an endocrine tumor.
I mean, the phalloplasty surgery can take up to 9 months of recovery time. Some trans guys have to learn how to walk again. And so these female people are never going to have a penis that works like a male penis. And these male people are never going to have a vagina that works like a female vagina.
You look at estrogen in a male, we're getting those levels up, bizarre levels of of estradiol in the bloodstream that cause clotting disorders and which make stroke a high liability. And so we're doing things to the body that then, if you stop it, your body's already been at risk. Your body has already changed. The damage is already done and it can't be repaired. The estrogen levels in a man are supposed to be, less than 15. If above that, you've got liver pathology because the liver is not metabolizing things. And here we are recommending elevated estrogen levels as part of a treatment protocol.
There was a landmark ruling recently by the High Court as a result of a judicial review brought against the Tavistock with respect to its prescription or its referrals for prescription of puberty blockers for children and young people. And this judicial review was brought about by a young woman called Kira Bell and a co-claimant called Mrs. A, who was taking the action on behalf of her child. And Kira had been referred to the Tavistock at the age of 15, at a time when she was suffering from depression, anxiety, and social isolation. At the age of 16, she was given puberty blockers, followed by cross-sex hormones at the age of 17. When she reached the age of 20, she had got fed up with using the breast binder that she had purchased and that she was using to flatten her breasts. She thought it would be an appropriate thing to have her breasts amputated. And so at the age of 20, she went through with a double mastectomy. Not long afterwards, she realized that she'd made a serious mistake, that the decisions she had made during her teenage years had been rash decisions and ill thought through.
It was very encouraging to see the Tavistock Judicial Review come down on the side of demanding good evidence, both good evidence of the efficacy of the procedures, which it did not find, and good evidence that young people really understood the full ramifications of a decision, and the court found that children under the age of 16 were extremely unlikely to be able to understand the consequences of making such decisions, and that there was poor evidence supporting this treatment. The Tavistock Clinic, because they've got the centralized National Health Service, they are publicly accountable in a way that the pediatric gender clinics that have sprung up in the US are not.
People that actually worked at the Tavistock who left because of the way that this condition was being approached, and they had legitimate concerns about that. Recognizing that when we're talking about, especially when we're talking about treating children, these drugs are being given, the hormones, the puberty blockers are being given without explicit approval by the Food and Drug Administration. They've not been approved for these indications.
I shudder to think of how many more people like us are going to have to go through this before everyone's like, wait, time out. What the hell were we doing? As far as my daughter goes, I don't know.
Until enough kids get harmed, and that's so depressing.
I have a little bit of hope for my daughter, just because she was on the testosterone for 4.5 months, and it did a lot of damage to her brain because she had some underlying issues. She should never have even been prescribed testosterone, but that doesn't matter to Planned Parenthood. So she has a lot of memory problems now, and that really bothers her. For society, I think people are going to wake up slowly as we get our stories out and they get to hear the truth, and more of the detransitioners are able to get their stories out, and hopefully some, medical lawsuits come about from all the harm that's being done.
I was able to find an attorney in Minnesota who is an absolute godsend. And once he was brought on into my case at the family courts, they finally had to start taking me seriously. And that's when things really started to change. My attorney was able to then have me taken seriously, and they started to back off. And they started, I think, to realize that there's a liability issue involved here.
Here we are watching the naked emperor go down, and I have the gall to say, excuse me, but the emperor is buck naked. And finally, people nod their head and the folly is over. The chair emeritus of the Hopkins Psychiatric Division, he and I have had a chance to sit together and talk at length several times. And he said, I will tell you what is going to happen to change the tide. It is going to be major lawsuits by families or individuals who've been through this, gone down that pathway and come back at the other side. And they are going to take down not only the physicians, but the drug companies and the hospital healthcare systems and the insurance companies that allowed this to happen. And that's when this will all end.